I always had dental care, but I picked the wrong parents because the dental gene wasn't so great, even though I was very meticulous in trying to keep my mouth good and clean. So I've had my share of cavities and fillings. And as one gets older, sometimes the fillings crack and a bigger filling is put in, and sometimes that fails and a crown has to be put on. So I saw Dr. Ghazi when I was about middle age, in my 50s. And some of the work had been broken down. Some of them were to the point where some of the teeth had to be removed. And in the old days, and it's still today, a bridge would have had to be made. But with the implants, literally replaces the tooth that's been taken out. And so I've had implant dentistry done by Dr. Ghazi, which I probably would not have had if I were getting them done when I was in my 40s or 50s, because the techniques weren't as good. So I've had that. It feels like your own tooth once it's in there. And so when you brush and floss and do things like that, you're not even paying attention. Whereas if you had a bridge, you'd have to deal with that and get toothbrush or flossing equipment underneath the bridge. It's just so much easier to keep your mouth clean with the implants. I'm sure it's hard for the dentist doing it, but as a patient, I found the appointments very easy, and about maybe an hour and a half, and it was very non-traumatic. If the treatment plan calls for an implant versus a bridge, do the implant every time, because number one, it'll be much easier to take care of over a period of years, hygiene-wise, in your mouth, and it'll just feel so much more like your own natural tooth. I forget even where they are in my mouth.